Senator from Montana.
Thank you, Madam President. I've got a number of things that I wanted to talk about today. On Monday of this week, we lost a fine lady in Kay Hagan. It is very difficult for me to put into words my admiration for the senator from North Carolina. But the fact is that Kay was the kind of person, the first time you met her, you felt at ease. She had the ability to calm a situation down. When she was running in 2008, I went to North Carolina, and she had an event at a farm, I think it was a hog operation, if my memory serves me correct, and had a chance to meet her for the first time, and really, she was somebody that you knew, if she was able to get into this body, would be successful. Well, in 2008, she won that election, and she came here and she made a difference. She made a difference for working families and small businesses and family farm agriculture. And I just wanted to express my condolences to her husband, Chip, and her kids and grandkids, and let them know that she was very loved by all in this body. Madam President, I also want to rise today and speak on behalf of the thousands of Montanans who have pre-existing conditions or struggle with the cost of prescription drugs. Even with the Affordable Care Act's protections, many of these folks struggle to afford their medical bills, their co-pays at the pharmacy counter, their local doctor's offices. But instead of working to fix these problems, this administration, the Trump administration, has issued a rule that brings us back to the dark ages by letting insurance companies discriminate against hardworking families across Montana and across this country. The Affordable Care Act guaranteed health coverage for all Americans. It required health insurance companies to issue policies to folks regardless of whether or not they had pre-existing conditions. But the Trump administration is chipping away at these laws, and they're tossing the protections out the window so that big insurance can make big bucks. Health insurance companies across this country are flooding the market with junk plans. They are called junk plans because they're cheap insurance that are junk. And when you think you have health insurance and you get sick, it's not there. And trust me, I know firsthand how this works. When I was 9 years old, I lost 3 fingers in a meat grinder, and my folks thought they had insurance. They didn't, because they had bought a junk plan. They ended up paying every dime for the surgeries related to my left hand out of their pockets. Money that they didn't have. These plans tell folks they got insurance, but truthfully they don't. They've got less coverage, and they don't even cover the most essential health benefits. You need prescription drugs? You can get them, but it's going to cost you. Maternity care? Sorry, the plan doesn't cover that. Mental health? You get that coverage in your wildest dreams. These insurers tell you you're getting a great deal, but the truth of the matter is your pocketbook is going to pay the price. And God forbid if you ever get in a situation where you need to use it. So what we see is insurance companies lining their pockets, selling plans that do nothing. And the majority leader is working to make it easier for them to do it, all while blocking reasonable bipartisan bills to improve the ACA and make health care more affordable to working families and small businesses around this country. The Senate was established by our founders as the greatest deliberative body in the world, to be a check and balance on the office of the presidency, the executive branch. It simply is not occurring right now. I mean, take a look at the tariff situation. The president puts on tariffs, a knee-jerk reaction, doesn't bring any of our allies along. We're seeing small businesses and family farm agriculture literally being to the point of being put out of business, and this body lets him do it. A couple weeks ago, the president said, you know what, we're pulling our troops out northern Syria, and to hell with our allies. The Kurds, who have been fighting with us, fighting as partners for the last 15 years, well, too bad. Done nothing about it. No checks and balances. The president asked for other countries to come in and influence our elections, and it seems like the Senate's just fine with that. The greatest country in the world is going to let other countries determine who's elected to our elected offices in this country, whether it be the presidency, the Senate, or any others. And now, can't even pass a budget. Continue to kick the can down the road. And we do have a vote on the defense bill, which, by the way, this body is going to allow the president, if the majority leader has his way, to take any amount of money they want out of that defense bill, put it into a wall that costs $25 to $35 million a mile, and we're not even talking about expenses down the road for upkeep. So we just deal with continuing resolutions. More uncertainty for families, more uncertainty for business. So right now we're standing by letting funding for our schools, our roads, our hospitals run out, leaving families across this country, especially in rural America and states like Montana, without resources to be able to do their job. And that is exactly the case for community health centers in this country. These facilities provide life-saving care to nearly 1/10 of the people in Montana, running 65 healthcare clinics across our treasure state, and they don't even know if they're going to have funding come November 21st when the continuing resolution that we passed expires. So how can we expect these places to stay open, let alone recruit and retain staff, when they don't even know if they're going to be around in another month? What do I say to folks where there are community health clinics like Hardin or Libby or Havre? These communities rely on these health clinics to keep their communities healthy. And quite frankly, because we can't sit down and negotiate and come up with long-term funding agreements, they potentially are going to be out of business. But the uncertainty for families doesn't start there. The number of kids who don't have insurance has gone up since this administration started its war on health care. Kids in Montana are getting the worst of it. The number of kids in my state without insurance went up 25% between 2016 and 2018. Let me say that again. The number of kids in the state of Montana without insurance went up 25% between 2016 and 2018. That's the 5th highest percentage jump in the United States. There's places worse. And the kids being hit hardest are the kids that are in the most vulnerable groups. They're an Indian country which continues to have the highest uninsured rate in this country. These young folks are our future leaders. They're our next generation, and we're not doing our job. We are failing them. This coordinated sabotage of our healthcare system by this administration and this body is unacceptable, and our children deserve better. I'm not going to sit here and tell you that the Affordable Care Act was perfect. I said from day one we need to work together to make improvements and build upon the successes that were in that bill. The ACA allowed states like Montana to pass Medicaid expansion that insured more than 90,000 Montanans in the process and helped greatly towards keeping our small hospitals open. It helped millions of Montanans with pre-existing conditions rest easy at night, knowing that they weren't going to be kicked off their plans because of that pre-existing condition or hit an annual cap on care. All that's gone. Americans have spoken clearly that they want more access to affordability, not less. And when my colleagues on the other side of the aisle attempted to repeal the ACA a couple of years ago, folks all across this country stood up and said no. But here we are again, watching the majority and the Trump administration pushing plans that will rip away affordable health insurance from hardworking Americans. I would encourage my colleagues to join together in work and find a bipartisan solution to improve our health care system. We need to reduce health insurance premiums and out-of-pocket costs. We need to crack down on skyrocketing prescription drugs, and we need to expand insurance to more Americans. And we need to make sure that when people put their hard-earned money on the line to buy an insurance policy, that it is not junk. Now on a lighter subject. Back in my early years on the farm, I'd come in on Wednesday night, and there'd be baseball night in Canada. And I got to watch the Montreal Expos for a couple decades, play some pretty darn good baseball. They didn't win, but they were very entertaining. That franchise was moved to Washington, D.C., I think in 2006. Same year I got elected to the United States Senate. So consequently, I got to watch the Nats, be entertained by them again, occasionally even in person. Last night, they did the impossible. After being 19-31, I believe around the 23rd, 24th of May of this year, they ripped off 100 games and won the World Series. And I just want to congratulate them on that feat and look forward to a repeat next season. I yield the floor.